People think plastic surgery and think liposuction and mummy makeovers, but really at the core of plastic surgery is our reconstructive practice, and that's restoring form and function and trying to get a patient back to whatever their ideal or baseline is after something like an accident or a cancer diagnosis.
We do a lot of craniofacial reconstruction for trauma, breast reconstruction, extremity wound care and reconstruction. Some of it is cancer related, some of it is congenital from birth defects and things like that, but the preponderance of what we do is a lot of trauma. My specialty is craniofacial, although I do a broad spectrum of general plastics, including hand.
Most of my patients have had a diagnosis of breast cancer and either had part or all of their breasts removed. Some patients have had radiation therapy, some women have required chemotherapy, and most of my work is trying to give them back a sense of wholeness after cancer has taken something from them. Be that restoring size, position, nipple reconstruction. I oftentimes can make them a little bit better than they were before their diagnosis, but truly trying to make them whole again after cancer has taken something.
Dr. Ferguson she's just warm and welcoming and positive and highly knowledgeable and somebody I feel I can trust. It's part of the process. I had breast cancer, and so since the reconstructive surgery, there's different steps that you have to follow up, just like any regular care and maintenance of your body. You have to follow up and make sure that you're healing properly. And your body image is something that everybody is very self-conscious about, and it's important to be comfortable with the person you're talking to.
It's everything. It is truly everything to help somebody feel whole again after cancer. I know that it's not my idea of what is proportionate or beautiful. It's what they want. It truly is meeting them with their goals where they are. And there's absolutely nothing better than watching somebody leave with the confidence that they deserve to carry themselves with.
Sometimes it's really saving their limbs and their function and sometimes their lives so that they can actually be integrated in society and continue to be productive, integrated people in the community.
There's a lot of talk about physician burnout and burnout in healthcare and medicine, and I really believe the secret to not burning out is to do work every day that fills you. And so while sometimes coming to work is exhausting and a bad diagnosis can really be heartbreaking, I go home every day filled by the work I do with my patients, with students, residents, with our learners. My work is what fills me. It doesn't drain me. I think that's the secret to burnout. I will spend my whole career here if they let me.